transferring patients to hospital staff, stable patients and critical patients. There's a different way to present both. In this video, I'm gonna break down to you exactly how to do it. Check it out. So whether you're doing interfacility transports, dropping off a dialysis patient with abnormal lab results, or dropping off a trauma victim who's very unstable and may be going into arrest, when you go into the hospital, what you want to do is approach it very, very, very professionally, because everybody's paying attention to you, especially during critical patients. And what you say, what comes out of your mouth, will most likely be used to determine your level of competency. Whether you're nervous, whether you're saying prudent things, all this information will be used by hospital staff to know and determine whether or not you know what you're doing and whether or not you did the right thing for this patient. So the most stable patients, let's say a person who's on dialysis and they came out with hyperkalemia in their lab results, and you're taking them to the hospital so they can get a blood transfusion or anything along those lines. These patients, the way you want to present them is just explain the reason why the ambulance was called. Let them know anything that happened that was relevant to why they're at the hospital, or anything that happened en route that the hospital needs to know. And then just transfer care. Get a signature. That's pretty much it. And the reason why I bring this up is because I've seen EMTs go on a rant explaining that the furniture was green and the curtains were red and it wasn't matching and the person's dog was in the bathroom, and there's a whole bunch of information that the nurse may or may not give a damn about. Most likely she or he doesn't care, and it has nothing to do with the person's particular situation. So it doesn't mean withhold information. What it does mean is make sure that you stay concise and to the point. Now, when you have critical patients, the way I document is the way I present. For example, documentation. What did you see? What did you see that was prudent to what's going on? Then your head-to-toe assessment, documentation. Any pertinent findings to the issue that's going on with the patient. What treatment did you give? How did you transport? And were there any positive or negative changes to the treatment that you gave? So it may look something like this. 21-year-old male. This is me presenting to the trauma team. And by the way, when you present to the trauma team or the notification team, make sure you do your notification. Make sure you speak to online medical control if necessary. You can look through the videos here. Check out the tabs in the top. These different videos will help you be better prepared. Here's another one for those particular situations. Now, after you give your notification, using the video that I mentioned, once you arrive at the hospital, make sure that before you start speaking, they are ready to listen. Don't start giving your report to a nurse, because the nurse is not the person making the decisions. The attending and the emergency medicine residents are the ones that will be making the decisions for this patient, most likely. So, are you ready for reports? Is what you ask. And when you ask it, make sure that your voice is above the level of the noise that's around it. So what I mean is, you don't have to shout at the top of your lungs, but if everybody's speaking up, you don't want to speak below them, because then what ends up happening is they're going to be asking you to repeat yourself every 5 seconds. So make sure you speak loud enough and with enough authority, because that's your patient. You just finished saving their life. You must just finish keeping them alive. You've just finished doing no harm. There's no need for you to belittle yourself and talk down. So make sure to speak up. So after speaking up, what you want to do is this. Let them know how you found them. Once again, head to toe, treatment, and reactions. So what it will look like is, here's a 21-year-old male. We found him on the street corner. Immediately after a car accident, he was struck by a vehicle. The vehicle was going at approximately 40 miles an hour. It was a hit and run. We found him with a femur fracture, and then mentioned the treatment. We put him on a C-collar, like You could mention this stuff. You write it down and you also mention it to them. We put him on a C-collar. We took vitals. We find hypotension. We started a large bore IV. We gave him 1.5 liters of fluids. We transported expeditiously. We were on scene for less than 10 minutes. And while on the way here, we noticed that he was hypoventilating. And then we intubated him. And now that he's intubated, the capnography was at initial of 20. And then just go on everything that you saw. Notice I mentioned the femur fracture. Notice I mentioned what was on his body. Things along those lines. Then you finish off by saying whether it was a positive or negative reaction to the treatment. So notice I went from what we saw in his body, what we did, and his reaction. That's it. Usually the report is anywhere between 40 to 50 seconds if you're very precise with it. Now, once again, if you approach the reporting of the patient with confidence, with a prudent tone, with that's combating the surrounding noise, if you present to medical control the way I explained in the video, if you do all these things, what will end up happening is that you will protect and improve your reputation in most cases. And that's what we want, because remember, at the end of the day, EMS is just like a high school where you get paid. Rumors fly, what you prefer to eat flies, and the way you wear your uniform, all these things matter, especially the way you present a patient. So please don't let this information go over your head. Apply it as mentioned, and I guarantee you it'll help you tremendously. And shout out to the subscriber who left a comment and inspired the creation of this video. If you want me to speak to you about anything related to EMS, healthcare, life improvement, anything along those lines, just leave a comment down below and I'll make a video just for you the same way I did for that brother. Thank you guys. God bless. Peace.